everyone, my name is Lindsay Sutton. I am an occupational therapist and I specialize in pelvic floor therapy. I work with many different populations and symptoms, circumstances, and diagnoses, and pregnancy is one of the ones that I absolutely love to help women with, pregnancy and postpartum, because it's a huge change for the body and different demands on our pelvic floor. And so what the pelvic floor was prior to pregnancy is probably pretty different from what it feels like now. And there often may be symptoms or signs of just pelvic floor change, mismanagement, sometimes it's called dysfunction. Those, of course, are any of the pains, the jabbing, burning, itchy, anything that is happening in the pelvic floor. Maybe it's the leaks, maybe it's the constipation. Maybe it's the frequent urination. Things like that are all within my realm of scope of clinical practice. And in today's video, I am sharing with you some movement practices that I know to be really helpful to support during pregnancy. I'm going to just call this today prenatal. It can really be, what I'm going to show today can really be used anytime in life, as well as postpartum, but these particular moves that I've linked together are really targeting some of the muscles that are changing or being put on demand in ways that they haven't before, and to really help the body prepare for birth delivery. If you already have an exercise routine, these are not to replace it. These will certainly help complement it. You do not have to do all of these exercises or movements that I show. You can certainly pull and pick from what you like or don't like. These are intended to also help keep your body in good alignment to the extent that we can when baby is growing forward and there is more load being placed in the posterior lumbar region, low back, as well as to help make sure our breathing techniques are there with us, because the breath is going to be the first way we connect to our pelvic floor, especially during birth delivery, and we really want to help prepare. So let's start with, and any of these moves, maybe a couple of them not so, but most of these moves, we'll say, can be done in different positions. So side lying, seated, standing, kneeling. And so a lot of them are basic moves of the spine. The first one is just what is spinal extension and flexion. Sometimes we call it cat-cow, back rounding, back bending, things like that. If you have a physio ball or a birthing ball at home, I love these. I do want to suggest that the height of the birth ball, when you sit on it, allows the knees to be just either at 90 degrees or hip level or just below. Anything a lot larger than that or a lot smaller than that won't give you the optimal position to set your body up for some of these things. So just actually that, start bouncing. So just nice bouncing is always great to do. It really just helps the pelvic floor kind of connect, right? It's okay. You are not gonna lose anything from the pelvic floor. I also want to encourage you that you don't have to squeeze the pelvic floor all the time. And when I squeeze the pelvic floor, our pelvic floor is kind of like a bowl. It sits with a bunch of different muscles that do connect from front to back. And so it's really interconnected. What happens back here is going to affect here. What happens here is going to affect here. And these side ligaments and other tissues that are happening here as baby is growing as well. And so just some nice gentle movements, soothing movements, rocking and bounces on a physio ball are really great ways to help the body just wind down, kind of regulate, de-stress, any of the above. Maybe take a few deep breaths. And I always encourage everybody to start with the exhale first. So just, and then inhale. And what that does is clear the pathway out so that it gets rid of the old air in the lungs and it more effectively helps the body breathe back in. If you can, throughout this practice, try to keep your breath somewhere between 4 to 5 counts for both the inhale and exhale. If you forget that, just come back to it. It's not a big deal. We'll go ahead and do spinal extension. This is back bending. The body probably likes to go here already because baby is here and our bodies go this way when we are pregnant. More importantly, I want you to try to maintain as much as you can. It will depend where baby's sitting. You can widen those legs for sure, but just a little bit of a pelvic tilt and back rounding. You can have hands on knees. And then I'll just show this. This is cat-cow. So you can do this in seated. You can do this over the stability ball, back bend, back round. And you can do this in all fours. Back bend and back round. Typically, the inhale happens on the back bend, and the exhale happens rounding the back. And I know I'm trying to like kind of demo thinking if I have babies still with me here, there's not a lot of room to go here. So don't feel like you have to crunch down. Instead, take a look at my top back and try to round upwards. So rather than it being a crunch in, push into the back so that you really get this space between the shoulder blades and you open up through the back of the rib cage. And right there, after you've exhaled, maybe even try holding there and taking an inhale. And release. You can do this as many times and in any different position that feels good for you. Again, you can even do this kind of more up, kneeling where you're back bending and back rounding. Any movement is good. Just know how it feels in your body. And when your body says stop or where you find pain in any position, switch positions and try something different. Another pose that is a nice one to do during prenatal and pregnancy is kind of like a mix between child's pose, puppy pose. Once baby grows, that like really big child's pose is going to feel less comfortable. So I always like to stay maybe up on the forearms, maybe widen the legs and push back. Always have a block or something nearby that maybe you can put the head on. And then if it feels better that way, you can sit back. You can also use the ball to sit back, and this gives belly a little bit more room. I like child's pose for the practice of the breath. Here, the pelvic floor is actually lengthened. It's already in a position where the muscles themselves from the tailbone around underneath the sit bones are in this lengthened position. And it's a good position to just practice letting the pelvic floor down a little bit or nudging it downwards. So the sensation is as you inhale, the movement goes down through to think the tailbone or the perineal body between both the front and back of the pelvic floor. And as you exhale, let that nudge go and just kind of reset. If you want a little bit of pelvic floor activation there, which is in the other way, right, the squeeze, it really is a squeeze and lift. And so as you exhale, you're gonna go ahead and try and think about just that space around the perineal body. Hug in from all around the pelvic floor. Remember, the pelvic floor is a bowl, 3D. It's not just front and back or side to side. So think that perineal body on your exhale, squeeze, and then gently lift the perineal body up into the body, the rest of the body. Inhale, let that go. Send the length down through the perineal body with a gentle, almost nudge downwards. Not like a push or a heave-ho, just a gentle nudge downwards. You can also use some side rolls here. Opening side body. Opening side body. This is a great space to inhale into. And that will really help create length and space for your breath. Coming back to the ball, some seated hip circling is a nice way to maintain mobility in the hips. And again, you can have a wider knee stance or a narrow knee stance, whichever feels best. But also just notice too, you want to sit like, so you're more centered on the ball, not too far forward, not too far back. And then you really are just doing hip circles. You can make them big. You can kind of play around with the hip circling from small to big, and then switch directions. And really notice this, of course, I mean, there's nowhere else for your pelvic floor to go, so it is going to feel like you are kind of rolling over the pelvic floor. That is okay. And in fact, it really helps give proprioceptive, kind of from something to the body input on the pelvic floor. And maybe you can again practice here. What does it feel like to create some range of motion in the pelvic floor? When I inhale, I kind of feel that nudge down, and when I exhale, I kind of feel this gentle lift up. You can even do like a little hug the baby breath, so that's kind of the perineal body hug and lift, but also the baby belly probably lifts just a little bit. My best advice is with that exhale in like a gentle hug the baby is let your breath exhale do the work or lead the movement here. So it's a difference between me going, right, heave ho, and you can also add figure eights into the hip circling. Again, hip mobility, very important for pelvic floor health, absolutely. You can go side to side. You can do kind of like vertical circles, side to side. You can play around with this and just kind of pick legs up. Side, side. It's okay to use the stability ball, the physio ball, to help kind of liberate or free up the pelvis and the pelvic floor. Coming down to the floor, these are a set specific exercise that I really think helps to stabilize the hips by creating external hip support. These are your hip abductors, your glute meds. It also, then the next one after that I'll show does internal rotation, so it works on your hip internal rotators, and then we'll do some circling of the hips. So they're called clamshells. You have probably seen me do these if you've come to class or heard of them on the internet. The most important thing is just, I tuck my arms sometimes into my head, but if you have a block or a pillow, you can use that as well to rest your head on. So you will side lie. This is going to be the best way to do this clamshell. It's not the only way to do hip abduction. So if side lying is not accessible, I will show another way to go about this. But for this exercise, head over heart, over hips, over heels, line up. My knees tuck in towards the body. And on my exhale, I glue the insteps of my feet together. I make sure my bottom leg stays on the ground. I am not going to move anywhere from my upper body. I'm going to stay glued to the ground this way. So I'm pretty stacked. And the only thing that's going to lift is this top leg. And it's really only going to go about this high. If you are going a lot higher, you've probably rolled through the hips. This will be challenging because there's baby weight here. The exhale again is to lift and lower. Inhale. You can always add your pelvic floor activation in these movements. Your exhale, squeeze, hug the pelvic floor up into the body. Inhale, let it go. You will be feeling a lot of this work here in the side hip area. If you feel it anywhere else up the chain, like in the back or at that sacrum top of the butt where the low back meets, we probably need to look at alignment or some other muscle imbalance that's taking over. Sometimes other muscles like to do the work of the muscles that are supposed to do this. So it's not that you are doing it wrong or something's going on that's wrong. It's just we would need to look at what else is trying to get in the way. So again, that alignment is head over heart, over hips, over heels, knees draw in. The movement is pretty much just a knee lift and lower. Keep the rest of the body pretty glued to the ground and just making sure that the head is raised up enough so that it feels in line with your spine. And then we're going to switch the movement so that instead of the knee lifting, it's going to be the foot lifting. Same principle. On the lift is the exhale. On the inhale is the lower down. these are reverse clamshells. And so just know that we're working the side hip internal rotators through these different movements that I'm showing. And I recommend doing anywhere from like 5 times in a row to 8 times in a row. And you can do the clamshell and the reverse clamshell, and then what I'm going to show now, the hip circle, and then you can switch sides or you can mix and match. There is no perfect way to do this. So hip circles are just what it sounds like. You may need to kind of anchor yourself with the other hand here and just kind of lead with your knee in one direction. If you have some symphysis pubic dysfunction, I would almost kickstand the foot out a little bit for internal rotation. That the pubic symphysis will like that better. If this still hurts, just make smaller knee circles, or we can find a different position for the circling. You can again switch directions. You can go just to the point where it feels comfortable and in a pain-free range of motion. Even this movement is going to put these outside muscles at work. You will feel these hip abductors, external rotator muscles. You may feel some in the hip crease as well. Again, as long as it's not pain and it just feels like these muscles are working, you're on the right track. All right, in this move, what we're aiming to do is some torso rotation. This is great for, again, kind of a prenatal approach to twisting because deep twists aren't going to be the best. Like we typically want to keep belly button, navel center in line with the hips. So we're not going to be doing huge twists around the core or belly center. And of course, once baby grows, it's going to be a little bit more challenging to twist anyway. However, that said, we have to twist in our life. So don't be afraid to twist. We have to twist to get our seatbelts into the buckle here, right? We're gonna twist to turn around and look, if somebody's behind us, things like that. So please don't feel afraid to twist, but also know that it's gonna be more difficult as rib cage and torso mobility becomes impacted by the growth of baby. So what I really liked for kind of keeping the rib cage, thoracic upper body able to twist and move is using some sort of stretchy band. But it could be, if you've got a long towel or a scarf or a tie or a yoga strap, that could also work here. I like the stretchy bands because it gives a little bit of resistance here, which is what we are going to do. You are in a staggered stance. If you want to call this warrior one, that's what I would call it in a yoga class. So we're in a staggered stance. Bring the hands out in front of you. You can pull the band as taut as it feels good with just some resistance. You'll inhale here, straight on neutral. And exhale, you're going to twist around the front leg. And then inhale, come back center. And exhale. Go ahead and repeat that. Maybe 3 to 5 times on each side, and then for 3 to 5 times on that side, and then come back to the other side. Switch your lead leg, same thing. You'll inhale in the neutral stance, exhale, twist. Noting that belly button is fairly in line with the hips. It's the torso that's twisting. Good, and come on back. Side bending is another wonderful movement to do for prenatal healthy movement. This can be done standing, this can be done kneeling, this can be done propped against a wall. This can also be done with the physio ball. And so in just standing, so say you were following that twist move we just did, you'd reach one hand alongside the body. Everything else follows the alignment principles of stacking head over heart, over hips, over heels. And then you'll slide one arm down along the side leg, reach the other arm up. What I also like to do here is bend this same side knee, create a little bit more stretch here. Inhale and exhale, and really go for length here rather than tipping over to the side. If it feels like, oh, I could just use a little bit more length there, go ahead, you can. But we're not really aiming to angle sideways completely. We're really looking to create length out of the body, the side body. Notice too here, rib cage. So I have had 3 children, so I definitely have a postpartum body that I'm always having to remind myself is instead of rib flaring, which absolutely happens after pregnancy, is to make sure that we maintain as much neutrality in the ribs as well. Bring the arm down and switch sides. You can hold for as many breaths as feels good. You can also flow with this, where it would be kind of inhale and exhale, inhale and exhale, side to side. Squatting is an excellent way to maintain hip health in pregnancy. Now, that may not always be a comfortable thing to do, so please know there are some other options to do with this band that I'll show, but let's start out with the squat. So I have a pretty long band. Yours can be one of those loop bands, it can be a skinnier band, it can have less or more resistance. You can have one of those fabric bands that are also wider and probably a little bit heavier resistance. So go with what you got and what you like to use. I'm going to use this one, which means I have to tie it. So I'm going to tie it around my thighs, and I'm going to tie this fairly tight or close together. Yeah. And then squatting. You're going to open the legs out just enough so you feel some resistance. It can be higher, the lower or closer to the knees. It actually adds a little bit extra, so just kind of play around with what feels good for your body. Your squat is going to be leading with the sit bones and the tailbone. So just from underneath the backside, right, the buttocks. And that is a really important cue, because if we lead back with our hips, we tend to curve back. And so it really is a sit and stand. I'll go sideways and just kind of be very conscious. If we lead back with the hips, a lot of times we arch really a lot more than what we need to. And because with pregnancy, that already is part of what happens in our posture, I'm going to ask more that we sit from underneath our hips into a squat, kind of a chair, right? And it's a gentle press out. So I'm not bowing or bringing my knees out. It's a gentle press out or activation into the band. What this does is help activate medial side hip muscles, medial glutes, very important muscles for maintaining hip stability and mobility. And a lot of times these muscles, as well as our glute max, which also is activating here in a squat, tend to get weaker from pregnancy. So any number of these, I would incorporate squats. You can do this within this flow 10 to 12 times for squats. You can do these in the kitchen. If you have a band, you can also do some other fun things. So if squats hurt the tailbone, hurt the low back, does not feel good, bring this band a little bit lower and do stuff like this, where you're walking and pressing out. Yeah. These are these side glute muscles. You can also kick back a little bit and just walk around. This is an alternative. You can, alternatively, I don't have a chair with me right now, but I'll show that in a different video where you can sit as well and use the band around the knee. Another variation of a squat is using a core or Pilates ball. It can be squishy, it can be completely blown up, but just enough that you're able to have some resistance. You would place the ball between the thighs, and this helps strengthen the adductor muscles, which is the inner thighs. This is also a nice thing to strengthen because it helps support through the pelvic floor. These muscles really are kind of like an accessory or helper muscle to the pelvic floor. So they're worthwhile keeping healthy in the long run, especially for pregnancy. And same, just as in a squat, you're going to squat down and up using the same principles of keeping kind of your movement through the hips downwards rather than backwards. We don't want to do that. We want to sit down into a chair below us, like that. The weight is a little bit, maybe a little bit more in the heels, or if you just kind of think head over heart, over hips, over heels, and then as you come back up, that's where you're pressing to, right? So here we come down, press back up to that head over heart, over hips, over heels. So you get some good activation up the back chain of connective and muscle tissue. And this is a type of lunge that can also be done on the ground. I prefer it on a chair. I feel that it's easier to maneuver around baby belly, as well as it's not as hard on the knee. But no, you can do something like this on the ground. I'll pull the chair away and show as well. But what you'll do, I call it kind of a knee, around the world hips lunge, and you're just kind of helping to open the space around the hips. You will prop your foot up on a bench or a chair. A stool is also doable. It does not have to be this high. In fact, actually, I would like it. I'm shorter. I would like it if my knee were just a little bit kind of level with my hips, but it's okay. Some of these things too, like if you have that inner groin pain or sensitivity, or the symphysis pubic dysfunction where you felt pain in that front pubic bone area, this is not going to be your friend. Lower down is going to be better, more narrow. And so always adjust so that your movement feels good to you. And you can always reach out to me as well to ask for tips on how to modify these exercises. So what you'll do is just, you can either freehand, you can use a hand for support. You're going to come forward and back. You can bend this knee a little bit back here. You can come kind of sideways, or kind of 3/4, halfway sideways. You can come full on sideways too. Things like that. You can move the lunge a little bit further out, so it is a deeper lunge as well. Remember to switch legs. This is, again, more for hip mobility. If we were to do this on the ground, it might look something like this. You want the foot out wide. You want the foot out wider. So notice in this one, I'm actually moving the bent leg, where from the chair, I was kind of moving the standing leg around. So a couple of different options for keeping the hips for, mobile, supple, movable, and hopefully pain-free. If you have a tennis ball, a lacrosse ball, something like this, go ahead and grab it, and we're gonna do some calf raises. If you don't, and you have a core ball, something like this, grab that. If you don't, you have a yoga block, you can grab something like this. And if you don't, and I don't have it in my reach, a rolled up towel. What you're gonna do, so let's start with this. You're gonna place the ball between the bottom instep space of the heel, and then bring the feet together. It's a little bit further there, right there. So the ball is not touching the ground, but it's just lifted off the ground. And you're gonna do some calf raises, up and down. So heel lifts off the ground. Maybe 15 of these. What does that look like with maybe the Pilates ball? Let's see. I would put that probably between my calves, or you could do, here we go, like that. What you're doing is creating midline activation between the legs, as well as activating the core to floor connection, right? So what our feet are doing is very much important for what our pelvic floor and core are doing, and vice versa. So strengthening the lower legs really helps keep the feet healthy. The block, similarly, you can lift and lower. And after this, I would find some sort of surface, whether it's a rolled up towel, kind of the edge of a step, a yoga block, and do a calf stretch. So to do a calf stretch, you would put the ball of the foot on the surface, let the heel rest on the ground below, and right there is just a calf stretch. You can bend the knee slightly, straighten the leg, kind of find where your happy stretch is, and hang there for at least 30 seconds. And after that, go ahead and switch sides. So that concludes our prenatal movement class or preparation. These movements, you can again pick and choose what you would like to do. You can do these as a series, or you can do a few of them if you really liked some of them, and if some of them create pain, just take those out. These can be used to support if you are already currently exercising, running, weightlifting, going to exercise classes. These are not intended to completely replace whatever your preferred exercise activity is. These are intended to supplement. And if you aren't currently exercising, these are intended to create some mobility and stability for your ever-changing pregnancy body to help you throughout those 9 months from start to finish. Enjoy.